Hey, guess what I'm here to talk about? Boobie tubies. I'm going to show you how I flush them because most people really don't know what that is, and I think you should know because it's not painful or anything, and it's really not a big deal. Okay, so really what they flush them with is saline. Just going to take these out of the package. Saline, which is basically, it's just salt water, really. I'm going to take this saline out of the packages, and then heparin. They use heparin to, sorry, I don't want to make a bunch of noise. Hep lock them so the tubes don't clot off, and because if you're not using them every day, then the blood can clot in them and then cause problems. Okay, so nurses will probably wear gloves. They don't make you, whenever you flush them at home, they don't make you wear gloves. I'm going to wear gloves because I want to be sanitary. Okay, so I'm going to put on these gloves, and they're really uncomfortable. And then in East Tennessee, they use Chlora scrubs. These little, they're like alcohol swabs, but it's a Chlora prep. It's a little stickier, and I don't know, apparently it works better. But here, they give us alcohol swabs, alcohol preps to do this with, and so I'm going to use these because this is what we've been using. So, what you do, I don't know if you can see. Oh, yes, you can. So we take, this is the white lumen. You have a white and a red. See, white and then red. I'm going to clean it off for 15 seconds. Or I'm just going to wing it because I don't want to count. Okay? So you get it good and clean. And normally you don't have to check for blood return if you're just flushing your lines, but because I want to show you how to flush your lines and how they would probably do it in the hospital, I'm going to check for blood return, and I'm going to leave it so you can see it. So it's dried for about 30 seconds, and you hook on, you just twist it on, and then there's this clamp right here, and you unclamp it. And the white one is a little bit harder for me to push because the tube is smaller. But you just push some in, and then you check for blood return by pulling back until you get some blood in there. Can you see that? Yep. So I'm going to leave that. It's fine just like that. And then I'm going to move on to the red one. The red one's a lot easier because it's a bigger size tube and everything, so I'm going to clean this off. It doesn't hurt. The saline, if you're nauseous and stuff, it can taste bad. Some kids like to have candy in their mouth or whatever if they're having to get saline or heparin. I think I can taste the saline, but I'm not nauseous, so it's okay. The heparin does taste bad too. Some people can't taste it. I can taste it. I think it tastes like a skunk. I mean, I've never eaten a skunk, but you get the gist. So you have to make sure your air bubbles out because you don't want any air bubble in there. So I'm going to twist this on. And the red one works much better. I don't know. So I'm going to push some in and then check for blood return. Look, see how much more blood that gave? And so now I'll move back to the white one, and you push. I normally push it all back in because I don't want to waste any blood. So you push it all back in, and then you can unscrew it. And then what you do is you take your heparin, so your line doesn't clot off. So you do that, and you just twist it on, and you push it, in, and then you just hook this, and then that line's flushed. My white lumen is flushed. Now the red, just push it all back in. Pretty simple. I'm going to heparinize it, or hep lock it is what they say. In East Tennessee, they tell you to flush your lines twice a day. Here, they only tell you to do it once. So, but they already did it at the hospital, but I just want to show you. So, it's not going to hurt me that I did it twice a day. It's not a big deal. So, yeah, that is how I flush my boobie tubies. And, yeah, and you just throw everything else away, and we're good. And, you know, you can feel it. If it's really cold, you can feel it, like, go into your vein and stuff, or you can taste it, and that's not good. But, yeah, and then I just kind of hide them under my shirt like this, and no one knows. It's like, who has tubes in their chest? Not me. Or do I? I'm just kidding. But, yeah, there you go. There's how I flush my port, or broviac catheter. Thanks.